Every year, millions of people worldwide have a stroke. It may have already happened to someone you know, perhaps a member of your family. In the simplest terms, a stroke is a brain attack. Those who survive have a good chance of recovery, but they may experience physical or cognitive deficits immediately afterwards. After a stroke, many people have trouble speaking and understanding what people say to them. This condition is called aphasia. More than half the people with symptoms of aphasia recover in the first few days, but for others, recovery takes longer. Unfortunately, friends and relatives of these stroke victims assume that because they have difficulty speaking, that they have difficulty thinking too. This is not necessarily true. After a stroke, a person's ability to think and communicate depends on the part or parts of the brain that has been affected. It's important to understand that surviving a stroke can be both frightening and frustrating. If the person is unable to explain their experience, this can deepen the trauma. Communication is also challenging for friends and family members who feel embarrassed or at a loss for words. They feel their own sense of disconnect because they cannot engage with the person they knew before the stroke. The goal of stroke rehabilitation therapy is to help stroke victims regain some or all of their skills. Speech therapists specialize in communication, while physical therapists and occupational therapists also play key roles in recovery. It is crucial that friends and relatives understand that what a person expresses externally after a stroke does not necessarily reflect what is going on internally. It helps to remember that the person who experienced the stroke is still the same person, except now they face new challenges. Let's look at how a stroke can influence the ability to communicate and how a person recovers their communication skills. A stroke is a brain injury that results from bleeding or a blockage in the brain. The effects can be sudden or gradual, and the damage may affect various aspects of mental and physical health. If a person who is having a stroke is fortunate enough to be in the right place at the right time, they will get the latest clot-busting drug that can reverse the damage. If you suspect someone of having a stroke, you must get them to the emergency room within 3 hours for their treatment to be most effective. The kind of treatment offered depends on the kind of stroke. Treatment for a clot is much different than treatment for a brain hemorrhage. Everyone should know the signs and symptoms of stroke. Knowing the signs of someone experiencing a stroke will have you prepared to act in time. Common stroke symptoms are sudden numbness or weakness of the face, arm, or leg, usually on one side of the body. Apparent confusion, or trouble speaking, or trouble understanding speech. Trouble seeing in one or both eyes. Difficulty walking, loss of balance or coordination. Severe headache with no known cause. Once you get the person to the emergency room, giving the doctor specific information about the symptoms will help the healthcare team to know more about the chances of recovery and the type of stroke. It may even save time determining the part of the brain that was affected. A stroke can affect a person's use of language in a variety of ways. It is common for a stroke to affect the part of the brain that controls the processing of language. Other deficits can include paralysis or weakness in the face, tongue, or throat muscles. A person may end up with brain injury that can make it hard to swallow, control breathing, or to form sounds. Primarily, there are 3 conditions that characterize affected communication after a stroke. The medical terms are aphasia, dysarthria, and dyspraxia. A stroke victim may experience one or a combination of these conditions. Let's explore these conditions in detail. Aphasia, sometimes called dysphagia, results from damage to an area of the brain that is referred to as the language control center. Damage to this part of the brain makes it difficult to understand long or complex sentences, especially if there is background noise or more than one person talking. A person suffering from aphasia may feel as if others are speaking a foreign language. In addition, their own speech may also be incoherent. If the damage is extensive, expressive aphasia can result. A person with this condition can understand others, but is unable to express themselves verbally. They are able to put words and sentences together in their mind, but cannot speak them or put them together to make coherent sentences. Typically, a person with expressive aphasia may form sounds, short words, or parts of sentences, but they either omit words or use incorrect words. Quite often, they may have the word on the tip of their tongue, but may be unable to get it out. For the speaker with this condition, they feel that they are talking normally, while to a listener, their speech is mostly incoherent. This leads listeners to assume that the speaker is confused when they are not. They have lost the ability to get their ideas across. This creates challenges in all aspects of communication, leading to heightened frustration on behalf of the stroke patient because they are unable to use language to convey thought. It is important for friends and family to understand that aphasia does not affect intelligence. In some cases, aphasia may only affect one form of communication, such as reading, listening, or speaking. In other cases, it may affect a combination. Dysarthria and dyspraxia relate to the physical production of sounds when speaking. A person with dysarthria can find the words, but cannot form them because of a physical problem, such as muscular weakness. As a result, words may come out slurred or in short bursts. Again, this is often misperceived as a reflection of the stroke victim's state of mind, but that is hardly the case. Dyspraxia involves difficulty with movement and coordination. This means that the muscles related to speech either do not work properly, or in the necessary order. Some other changes that can make it hard to contribute to conversations include a loss of tone, which helps express emotions in speech, a fixed facial expression, difficulty understanding humor, difficulty taking turns in a conversation. Some of these changes make it seem as if the person is depressed when they are not. It's important for friends and family to recognize and understand these changes. This way, letting others know about the situation can help prevent misunderstandings. However, there are cases where stroke damage is extensive enough that a person suffers with anosognosia, which is the inability to recognize that anything is wrong. This condition can hinder their recovery. There are other challenges after a stroke, such as altered mood, fatigue, and if the stroke results in vision or hearing loss. Fatigue is a common outcome after a stroke. This means that conversation can be tiring because it requires a significant amount of effort. Stress can exacerbate communication problems, especially if the person or others become impatient. Speech therapy is a crucial part of rehabilitation after a stroke. A speech therapist will start by assessing a person's ability to swallow after a stroke. This is important because the ability to swallow can affect how well a person produces language. The therapist also helps teach and practice activities that include repeating words, following directions, reading, and writing. Every case is unique in approach, but the therapist helps restore a person's ability to effectively communicate by helping the person rehearse speech. The speech therapist also provides conversational coaching and will develop prompts to help the person remember specific words. Much like the physical or occupational therapists, the speech therapist will find ways to get around specific disabilities. Let's talk about some things that will help make communication easier when communication with a friend or loved one after a stroke. Look directly at the person when you are speaking to them. Speak slowly and clearly, but use a normal tone of voice. Use short sentences and stick to one topic at a time. Keep background noise to a minimum. Reassure the person that you understand their frustration. Write things down if it will help. Find out about the person's employment, interests, and passions before the stroke, and try to relate to these. Give people a chance to say what they want to say, without jumping in or correcting them. Conversely, here are behaviors to avoid when communication with a person after a stroke. This will be a list of don'ts, for lack of a better term. Don't finish the person's sentences for them. Don't push them too much. Don't speak to the person when they need to concentrate on another task. Don't assume that the person is unintelligent. Don't talk down to the person or speak to them as if they are a child. Don't continue to talk when the person is disinterested. Speech therapy provides verbal communication training with language games that builds both simple and complex language skills. The goal is to encourage stroke patients to speak rather than use gestures as their primary means of communication. Speech therapy works, as studies have shown that language skills improve significantly in 85% of the stroke patients after speech therapy. In addition, another study reveals that stroke patients who received additional language training, which is reinforced by family members and friends, show further improvements. We have enjoyed bringing you another video, and thank you for watching this to the end. The tips and suggestions mentioned in this video are for general information purposes only, and should not be construed as professional medical advice. If you are concerned about the need for speech therapy for yourself or a loved one, it's important to consult with your physician to ensure that you have a clear understanding of this personal situation from a medical and mental health standpoint. If there is a health or wellness subject you would like to know more about, leave us a comment and we'll be happy to put together a video.